Good afternoon, and welcome to our Friday edition, June 26th media briefing and public update broadcast on YouTube and Cable 14. I am Deputy Mayor Tom Jackson, and thank you everyone for joining us this afternoon. Wish to immediately give you an update on His Worship, our Mayor Fred Eisenberger. As you may have heard, Mayor Eisenberger is self-isolating at home after experiencing symptoms associated with COVID-19 yesterday. The mayor did do his test earlier today, will be self-isolating and resting at home until he receives his results. Staff in the mayor's office and those who have come in contact with him recently are monitoring themselves for any symptoms and will take appropriate action as necessary. Mayor Eisenberger would like to extend a thank you to everyone who has reached out with well wishes at this time. I myself communicated with him last evening and chatted with him. He seemed to be in good spirits overall. This is a reminder to the public that this virus, unfortunately, is still in our community. We all must remain vigilant in protecting ourselves and our loved ones from the spread of COVID-19. Practicing good hygiene and adhering to public health recommendations is paramount. I personally, are all wishing our mayor the very best, and he will be sharing his test results once they become available. On to a quick update about the Summer Jobs Program for post-secondary students and recent graduates, about the grants for those who are volunteering this summer in between their studies. The federal government is launching the Canada Student Service Grant to give post-secondary students or recent grads who volunteer in their communities grants of up to between $1,000 and $5,000. Now, the amount of the grant will be based on the number of hours worked between June 18th and September 18th. More information can be found on the federal government's website through the quote, I want to help, unquote portal. The government will also put $40 million towards creating 5,000 MyTax internships at the post-secondary level. The new funding will allow the National Research Organization to extend programs for undergrads and in professional programs such as law, business, or medicine. In addition to these measures, the federal government also has announced funding for the Canada Summer Jobs to add 10,000 placements for students between 15 and 30 years of age, and 20,000 placements for university-level students through their Student Work Placement Program. That's an update for Summer Jobs Program from the federal government. Provincial updates, to our knowledge today, we have heard nothing new from the provincial government. Quickly, some city updates. One of my favorite times of the year, Seniors Month, which is June. As Mayor Eisenberger mentioned a few weeks back, this month we celebrate seniors across our entire city, recognizing the many accomplishments and contributions of the older adults in our community. Now more than ever, it is important we stay connected virtually with each other. Remember to make the time to reach out, check in on seniors in your life and in your neighborhood, especially during heat alerts over the summer months. I'm truly myself going to miss a wonderful, fabulous annual event that occurs every June at Michelangelo's Banquet Hall, the Seniors Awards Night, that usually attracts over 600 seniors from across our city and their families to recognize the top ones in various categories that have volunteered to help and make the lives of those that are shut-ins, those who have less mobility in our community as seniors, to make their lives and their quality of life a little more special, and letting people know that this community still cares about our frail elderly. I want to remind older adults that a great way to socialize and stay connected is through the Senior Center Without Walls program. Once again, that's the Senior Center Without Walls program. This program provides free recreational activities such as games, trivia, fitness tips over the phone with a group of older adults in the community. For more information, please visit www.hamilton.ca/SCWW. Once again, www.hamilton.ca/SCWW. SCWW to participate in seniors programs. Canada Day coming up July 1st, Wednesday. With Canada Day around the corner, a reminder that the City of Hamilton has a number of fun initiatives planned to help bring Hamiltonians together from a distance, of course, safely this Canada Day. For all the details on the events, visit hamilton.ca/Canada Day. Once again, that's hamilton.ca/Canada Day. Thank you again to one of our incredible agencies in our community, the Royal Botanical Gardens, for returning as a sponsor for the 6th year. Without their support, this would not be possible. And thank you to Tim Potisak and to Sonic Onion for producing this event. Now, with all of these updates said for now, I'd like to pass things over to someone who has been absolutely stellar as the key director of the Emergency Operations Center team and our normal general manager of the Healthy and Safe Communities Department, Director Paul Johnson, for some updates. Paul, over to you, please.
Thank you very much, Deputy Mayor Jackson, and thanks for those kind words. It's wonderful to work with you and the rest of council, and of course, I want to start by echoing our best wishes to Mayor Eisenberger. I was texting with him yesterday, and one of the things we had a lighthearted moment about is he said, you know, I'm listening. So when you feel sick, stay at home, get tested, reach out to public health, do all the right things. So we joked a little bit about how he's been listening to all of these sessions, and of course he's also been one that's been encouraging Hamiltonians to take that same advice.
True.
And we hope that that everything will be fine with our mayor. A few things today in terms of updates from the EOC. I want to talk a little bit about garage sales. We've had a number of questions come in and want to do this on two fronts. In general, garage sales, they are allowed. They're not prohibited under any provincial order. However, it's important to recognize that the gatherings of no more than 10 people do apply to things like garage sales. So our encouragement right now is this may not be the best activity to enter into at this particular moment in the pandemic. I know it's the time of year where we do a little bit of clean out, and certainly with all the at-home time we've all had, it is a great time to clean some things out. And you may be thinking about a garage sale. While I can't say today they are banned, I can say that if lots of people are showing up, you are responsible for ensuring that you do not host a gathering of more than 10 people, and therefore there could be a visit under that bylaw that we have within, or that power we have through bylaw under the provincial orders. There is a big event coming up that usually happens in the summer down in our beach strip area, and it's a garage sale times 100, 1,000. It is a big event, and it is an annual event that happens in the second kind of weekend in July. That event is not going ahead this year. We're working with the community. We're working with the local ward councillor to get the word out that that event has been canceled. Many people actually would come and set up yard sale, garage sale type items on city property. That's also prohibited, so that is not even allowed. But the residents themselves have agreed that this is just not the year to be bringing hundreds, and if the weather's great, I hear thousands of people down for what is a community-wide garage sale idea. So we are working with some messaging around that, but I want to make it clear that we'll be actively enforcing and ensuring that that event does not go forward this year. So it's just best to not push the envelope. Another summer, we'll be back at it down at the beach strip, I'm sure, with everybody getting together for a large garage sale. I know a number of people have been wondering, lots of people in our community, actually not a number, but lots have been wondering about the progress of opening childcare centers at the city of Hamilton. I just want to let you know that in the summertime period, about 130 childcare centers are in operation. There are others that operate only for the school year, but if we were taking a typical year, there'd be about 130 centers in operation. We have about 26 of them that have passed or in the process of having their inspections by public health, and by through next week, they will be open, and many more that are in the queue to get going. We understand that this is a challenge for families, that they were hopeful that childcare centers could get going very, very quickly. But the bottom line is that the public health guidelines around reopening childcare and the provincial guidelines around reopening childcare, they are very stringent. There's a lot of training that has to happen. And as you heard us mention in one of our earlier updates last week, that there is a requirement for a public health inspection before they can be approved to open. And that is to keep everybody safe. The reality for childcare centers is it is not an environment where we can separate everybody and make sure that it's only a 2-meter piece. Childcare centers, by their very nature, have interaction that happens and between children and caregivers who work there, and then obviously between children and the parents and caregivers who drop off and pick up. And so there's lots of protocols in place to make sure that we keep children and their families safe. And unfortunately, that also means that there are fewer spaces available. We know the challenge of that through families, but the good news is that a number of them are starting to open up. And we do know that half of those 130 have plans to be open in July. So a lot of them are moving along. And there was some media coverage that said that childcare centers, some of them were just not going to open. We've been working very hard with our childcare community around the funding that's required to make sure that they can operate with fewer children, but the same number of staff, if not more staff. And we're doing everything we can to ensure that as many childcare centers as possible can open. And I want to pass on my thanks to our public health team has been fantastic in setting out the guidelines and doing the inspections, and to our children's services team has been working one-on-one and having multiple conversations with our childcare community as well. I did mention that we're starting to permit sports fields for training only. Do want to let you know that we received some information that it was up to local municipalities to determine the numbers of people in the case of soccer who could be training on any pitch. And the city of Hamilton has determined that for large soccer fields, so for full-size soccer fields, there can be 2 cohorts of 10 people at either end of the field. And again, this is for training only. That's not 10 by 10 playing of a game. That's 10 in one end, 10 in the other end doing some training. And for our mini soccer fields, only 1 group of 10 will be able to train. And again, the real emphasis right now is this is about skills training. It is not about scrimmaging, not about games, but we've set those as our limits. And we think that will allow kids to participate, which is great. That's what we want, people to get out and be able to get some exercise and keep up their skills in terms of, in this case, soccer. And we know that baseball's starting up and things like that, but important to recognize that this is not about games. I want to end talking about our Hamilton Street Railway, who have been nothing but stellar in terms of the work that they've done throughout this pandemic and keeping service on the road. We are expanding the capacity of our ridership, and that has resulted in far fewer pass-bys. The results are really stunning. We're down to a much smaller number of pass-bys, and so for those taking transit who are frustrated in the early parts of this emergency by having to wait 1 or 2 times for a bus to be able to take them because of our restrictions on boardings, that is getting better and is much improved. And the other piece, of course, is that on the 1st of July, we will go back to collecting fares. We have asked the community and required the community, if you are riding transit, you must wear a non-medical mask. And the only exceptions to that are folks that are unable to for medical reasons, children under the age of 2, or anyone who cannot remove their mask on their own. But that should be the minority of individuals who are riding our transit system. And so we're not just encouraging, we're mandating that those masks are worn. Some initial data is really, really encouraging. We're at the high 70% clip in terms of mask use. We're verifying some of that through some of our busiest routes, but it looks like the community who rely on transit in the city of Hamilton are really stepping up. Our goal is about 90%. So maybe I'll put out a little challenge starting today, is how do we on our own? And I know I've been asked 1,000 times, are you going to hire people to police this? How are you going to do this? Are you going to hand out fines? And I've repeatedly said, people who rely on transit in Hamilton, they know how important transit is. They respect the transit operators and they respect the HSR. They just want it to be there for them with a consistent transit piece. So I think we can rise to this challenge. Let's get that extra 10 to 15% coverage, and we're going to feel really good about ourselves and not have had to do it with the threat of fine or the threat of anything else. And I think that's a great news story to end on, because when I heard some of the first data out of our HSR folks, I was really, really excited. I had worried it might be around the 50% mark, but it seems that many people are taking heed of our requirement for those masks, even in these early days of requiring it on HSR. So thanks very much. Those are my updates of the minute at the moment, and I'll turn things over to Dr. Tran.
Thanks, Director Johnson. Dr. Tran?
So thank you for having me. I also want to echo Paul and Deputy Mayor Jackson's comments in wishing the mayor a speedy recovery, and we can get back to his work and his leadership on this and many other issues. And also to thank Deputy Mayor Jackson for filling in on short notice. So in terms of our update of COVID cases, we, as of 9 a.m. Today, we have 823 cases. So that includes 814 lab confirmed cases as well as 9 probable cases. This is an increase of 4 new cases compared to yesterday. We still, fortunately, do not have any active outbreaks either in the community or in any of our institutions. So that is, again, really good news that we should be quite happy about. I do want to provide a couple updates in terms of how we report cases on our webpage, and that's effective as of today. So the first is in terms of how frequent we report cases. So since the pandemic has started and since we had our first active case out in the community, our surveillance team has been working tirelessly to ensure the community has timely and reliable updates, and have been updating our webpage on a daily basis in terms of the status of cases in Hamilton. Given our context has changed and things have been improving in terms of low number of new cases as well as of new outbreaks, our epidemiology and evaluation team are going to be transitioning to a Monday to Friday work schedule. So that means those are the days that their web page is going to be updated. So for example, for the end of the week, it's today, it's updated on Fridays morning, data as of 9 a.m. The next update after that on our webpage will be then Monday morning based on 9 a.m. data. I mean, we sort of want to thank our team who've been working quite diligently in terms of providing those numbers over the last 100 plus days, and we'll sort of keep an eye on it and hopefully can continue the Monday to Friday schedule. The second change is in terms of how certain types of information gets reported. And this is, as for those who are particularly keen and have an eye on our webpage, one of the categories that we report on is cases based on age, and it's currently reported by episode date. So episode date means when that case first developed symptoms or they were asymptomatic when they first got tested. So what we're actually moving toward is aligning it with how we report cases in general in terms of report dates, in terms of when that case was reported to us, usually from the lab. So that helps serve a couple purposes. One is gives more timely information because once we get a report date, we can update both the numbers on our case on our website as well as that particular category, rather than sort of waiting for a lag time when people develop symptoms or we are able to get a hold of them. And the second is it actually makes it easier for the public to understand, and it's also consistent with what our case reporting in general is. I think what that will mean is for those who, again, keep a very close eye on it, is that the numbers will, you'll see a change if you compare it to recent days as we change how that gets categorized. And the final update in terms of, given that it's Canada Day coming up on Wednesday, our drive-through is testing is going to be closed. As we've indicated in the past, we certainly prefer, are asking individuals who want to be tested to call and book an appointment. And that can be done at 905-974-9848. And we do that to ensure, I guess, safety for both the staff and the residents out there in terms of physical distancing and flow, making sure people aren't wasting their time, being turned away, and also so we can prioritize testing. So those who have symptoms and might be more worrisome versus those who are doing testing to be reassured. And I will hand it over back to Deputy Mayor.
Thank you, Dr. Tran, for the medical updates for our community. And I want to say two things. We've got the best leadership team in public health services in the province, in my humble opinion, with Dr. Elizabeth Richardson as our medical officer of health, and with yourself, Dr. Tran, and Dr. Bart Harvey as our two associate medical officers of health, done a yeoman's job during these last 4 months, especially. And although every life is very, very valuable and important, and I'm saddened by, I believe it's 44 Hamiltonians' lives that have been lost during these 4 months of the plague, and there's been approximately 823 cases you've confirmed, Dr. Tran, positive of COVID. I want to say that I believe on behalf of the overwhelming majority of our citizens in Hamilton, and the feedback that I'm getting now as things are opening up a little more through stage 2 and people I'm encountering and engaging, that overall Hamiltonians are feeling pretty darn good about themselves. And so they should be, but they followed all the rules and regulations properly, both from the province and from our EOC. And to have 44 deaths, every one of those lives valuable, and I'm saddened by the loss of them, and 823 positives. But overall, for a city of 550,000 approximately, I think Hamilton, a job well done, but not to let up or to rest on our laurels. I also have a few good news story updates, please, before we get to the media. Thank you again, General Manager Johnson, Dr. Tran. Like Mayor Eisenberger typically does, I do want to give a quick shout out to the following organizations who are finding innovative ways to share and connect with our community. Today, our Hamilton Animal Services have received a very generous donation of gourmet cat treats from greatergood.org. As somebody who's a cat lover and owns 2 cats, this is amazing. Wait till you hear this. Greatergood.org reached out to our animal services of the city to ask if we could use donations from Hearts, H-A-R-T-Z, offering over 30 skids of Hearts Delectables chowder lickable cat treats. The approximate value of this donation, $225,000. Wonderful, awesome. We will be sharing this generous donation with our community, focusing on our cat-owning vulnerable residents with limited disposable income. We are sharing this food with the colony caregivers of our Hamilton Community Cat Network as well. The colony caregivers are people that feed and care for the city's unowned cats. We have also reached out to our animal rescue partners that have assisted us in rehoming the cats that come into our shelter, and a number of local community organizations and partners supporting our most vulnerable residents in the community. So far, we know that Good Shepherd, our wonderful Good Shepherd centers, led by Brother Richard McPhee, will be picking up 5 of these skids of cat treats this afternoon. As I said, we sincerely thank greatergood.org for this very generous donation. Also, a couple of shout outs here quickly to the Art Gallery of Hamilton. The pandemic has put most summer camp programs sadly on hold, but that's not stopping our Art Gallery of Hamilton. The AGH is bringing summer camp to children's homes with Art Gallery Hamilton Camp in a Box. It's a bi-weekly subscription to creativity and fun through specialized kits full of art supplies. These are 4 to choose from: drawing, mixed media, sculpture, and collage. Plus, each kit contains an exclusive link to a live demonstration by one of the Art Gallery's expert artist educators. Go to artgalleryofhamilton.com. Once again, that's artgalleryofhamilton.com for more information. Now more than ever, the arts are so important, especially for our young people. Congratulations and thank you to Executive Director Shelley Falconer and her entire team at the Art Gallery of Hamilton. Also, a shout out to the Dundas Museum and Archives. The museum responded to the pandemic by making its collection and archives accessible with a new digital portal. And with museums allowed to reopen under stage 2 of the province's reopening plan, the staff at the Dundas Museum and Archives is working hard towards a July 2nd reopening with all necessary safety provisions in place. In the meantime, you can access the museum's collection at dundasmuseum.ca. That's dundasmuseum.ca. Congratulations and thank you, Curator Kevin Pudister and the entire team at Dundas Museum and Archives. Lastly, I'd like to always thank the frontline and essential workers that have just incredibly and with just heroic services to our community, especially from the essential line of workers, kept our city moving and looking after, especially those most vulnerable, to the best of their abilities, and keeping families aware and able to access all the services necessary, such as thank you to nurses, nursing home staff, cleaners, grocery store workers, truckers, and everyone who's going above and beyond during this awful pandemic. I continue to appreciate everything they do. All right, now I'm going to pass things over to our Senior Communications Director, Jasmine Graham, for any media questions. Jasmine, over to you, please.
Great. Thank you so much, Mr. Deputy Mayor. So we have 7 media on the phone today. That's quite a lot. We're going to start with Joey Coleman from the Public Record. So Joey, you can go ahead.
Dr. Tran, most of the new cases that we're reporting are community acquired. Out of those, how many of those do you not know where the individual acquired COVID? And from that, is there an estimate on the number of COVID cases in the general population that are undetected?
So thank you for your question, Joey. We generally categorize in terms of our cases in a couple of different categories in terms of acquisition. So one is being travel related. The second category is known contact with a case, either closer or casual. And then the third category is community. So community is the category where we haven't identified a specific source or can trace to another case. So those would be ones where we are unclear who exactly they acquired it from. We can't say in terms of our data what the prevalence out there in the community is. That's certainly a question that is on everyone's mind, and that's where in the future, if there's a surveillance testing, sort of more broadly, either with swabs or actually with blood work, you can have a better sense of the actual prevalence out there in the community.
To Paul Johnson, the rules and regulations that the Emergency Operations Center are implementing, where can members of the public get those rules and regulations passed? This is a public health emergency, not a public order emergency, so those should be somewhere that citizens can access easily.
I'm sorry, Joey, I'm not sure what are you asking for?
So when you're making decisions as the Emergency Operations Center in the municipal state of emergency, where can I find those decisions listed, the rules and regulations that are being created?
So we're not creating rules and regulations. We are making decisions, and those rules and regulations are often passed on to council. So in the case where we did feel we had to put in regulations, they were passed by council. An example of that is the fireworks ban, sale, and display, which is in effect through Canada Day. And then another example would be the physical distancing bylaw. In terms of our decision making, they are minuted as part of the EOC process, but those are not publicly available.
Great. Thank you, Paul. Next question will go to Dan Takuma from CBC Hamilton. Dan, you can go ahead.
Hey, everyone. I'm going to direct this to Dr. Tran, but if there's somebody who's better positioned to answer it, let me know. So when it comes to the mayor's test and the people that he was in close contact with who may be now self-isolating, has that affected the city's pandemic response in any way in terms of the people involved and who's kind of in leadership roles?
No, it hasn't in terms of roles and responsibilities. Obviously, you see here that, and we should note that the mayor had some symptoms of COVID-19. It's not been determined. He's gone for his test. He still is in contact with folks. So I think we're wishing him very well, but it's not a he just wanted to make sure that he got tested because of some of the symptoms that are there. But you see, we have a deputy mayor. We always have the continuity of council and the elected officials. And in terms of the Emergency Operations Center, though, we communicate regularly with the mayor around decisions. The Emergency Operations Center, he's not a direct member. He doesn't sit around our leadership table in terms of that regard. So things continue on, and our mayor, I know, is in contact with folks and really is just waiting to see the results of this. And if you look at just to go on a bit of a tangent here, but if you look at the list of symptoms, even our own screening, active screening for employees here at the City of Hamilton, I mean, many of them are common cold, severe allergy, those types of things. So the list of symptoms is growing as this virus has continued we learn more about this virus in the community. And in the early stages, it was all about travel and contact with travelers. And basically after that, there wasn't much left. Now the list of symptoms is much longer. So abundance of precaution and no change in terms of how things are getting done. And we certainly wish the mayor a speedy return. And really from a legislative perspective, I think the deputy mayor, I think it's the week of July the 6th is the next time we have committee and council meetings. So hopefully he's back in good shape by then.
Yeah, thanks, Paul. And I appreciate your point. I understand that we are awaiting a result, and I join you in wishing the mayor well. Can you tell me, besides the mayor, as he awaits the result of his test, how many people are self-isolating, and can you give me an idea of who?
So no, I can't give you that list for a couple of reasons. First of all, that's private information in terms of that. I mean, it's no secret that the mayor was in City Hall as part of council on this past Wednesday. So there are a few staff people, obviously, that are connected with us having to do the virtual council meetings, and we do require the person who's chairing those to be in the council chamber. So there's a very limited people, but I'm not going to share where they work or who they are.
Great, thank you, Paul. Next question is for Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thank you. My question is about the mayor's symptoms. I'm wondering what symptoms he has and if any staff have since started showing symptoms.
So I don't personally know what symptoms they were, and we wouldn't be sharing those, and I don't have any indication that we have symptomatic staff as a result of that either.
Okay, thank you. And my second question, it's probably a question best answered by Dr. Tran. It's regarding the family cluster. We understand that the increase in cases in children, I think there have been at least 10 new cases over the last week and a half or so in kids under the age of 9. And it was previously said that they were connected to a family cluster. So I'm just wondering if that's one family, if it's an extended family, if they all live in the same household, if they were all at one event, just some more information about those cases.
Sure. So my understanding, it wouldn't be one family. So it's generally what we've seen is a couple families that are larger. So that's one of those things when we take a look at the trends for the last 10 days, we sort of see if there are any age groups that have certainly higher rates than have been historical. And then we look to see if there's any patterns, anything of concern. So for the children 0 to 9, it's rather than whatever number individual different from individual different families and exposures. My understanding it's within a couple or a few families that happen to be larger that were tested during this time, and so that sometimes will skew results from time to time when you happen to have larger families that happen to get it with a certain age demographic. You might see blips in that in those numbers when you have you're working with low numbers, and that's what we've happened to see in the last 10 days. So so we're not talking about exposures to to that age group in general. They just happen to be a couple of larger families that happen to be tested positive for COVID.
Thank you.
Thanks, Dr. Tran. Next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. Today, the Premier said that when it comes to stage 3, that the province is working with all of the medical officers of health in Ontario, and that'll be a regional approach. So I was looking to find out if you have any ideas, Dr. Tran, on what the timeline might be for that, and what you're looking for when it comes to entering, what will be the criteria to enter stage 3.
So I don't have any information at this point. It's certainly always encouraging when the province and the Premier wants to engage medical officers of health and local medical officers of health on this type of decision. I don't have any further information or timeline, but we certainly look forward to working with the province and providing our input as well as our own local situation and context so that when stage 3 does come about, that's informed by the most appropriate data.
Great, thanks. And when it comes to closing the Mountain Testing Center, can you talk about, does that mean that not as many people are coming forward for testing? Like, are you seeing many people coming forward for testing now?
So I might need to clarify that question. I think when I provided the update, it was for because of the July 1st holiday, that one day, the drive-through testing center will be closed just for that one day. I'm not sure if you're, so that's what I was intending to say rather than it's being closed effective that day. It's just a one-day closure of due to the holiday.
Okay, thank you. That's likely my mistake. Are you seeing, though, can you talk about, what you're seeing right now in terms of people coming forward for testing? Are you seeing a lot more people or fewer people? Like, what is it like right now when it comes to people coming forward for testing?
Sorry, Dr. Tran, we'll just get you off mute there for a minute.
Okay. Short answer is we're seeing a lot more people getting tested in these past few weeks compared to the month or two before that. I mean, there's a couple reasons. I think the assessment centers have done a great job in quickly ramping up and pivoting in terms of being able to accommodate more and more people than had been initially planned for. So the increases in numbers have been caused by a couple of different policy directions by the province. So that is, initially, as Paul had mentioned, our focus in terms of testing was very limited. So first it was we're looking at travelers, we're looking at only 3 symptoms: fever, cough, shortness of breath, and it was really limited to those folks or people who have a clear contact. The province, and we've certainly aligned ourselves with it. It has completely opened it up, and then particularly more so in the last couple of weeks, where anyone who wants to be tested won't be denied a test, regardless of whether you have symptoms or not. So based on that provincial direction, certainly it's opened up not only people being eligible for tests, but as well as an interest. And the other reason is policy regards to testing for long-term care, retirement homes, regular testing that they're asking staff to do every couple of weeks, as well as visitors entering, and has led to a surge really in testing volume. So that's one of the reasons I wanted to highlight that we ask people to book an appointment because we don't want people just showing up. Ultimately, we want to test what you won't deny, but we want to make sure that it's prioritized and keeps with the health and safety of both the staff and those wanting to be tested, so we can have things a bit more orderly, physical distancing, and not having people sort of turn away that day, and then to prioritize those who are symptomatic compared to those who may be wanting to be tested for some reassurance.
Great, thank you so much, Dr. Tran. Next question to Dale from CHCH. Dale, you can go ahead.
Thank you very much for taking my questions, guys. This is a question is for Paul Johnson in regards to the soccer pitches that will be permitted. When is the date that people will be allowed to be on the soccer fields? And just is it limited to just soccer, or like can a football team, offense and defense, be on either side of a large field, 10 on each side or whatever?
So it's a great question. So fields are open for permitting for a variety of sports. The reason that I highlighted soccer today, because it's an example of where the provincial organization is not putting out guidelines for numbers. They're leaving that to local municipalities. So I just wanted to state from a soccer perspective, the municipality has stepped in and done that. For other sports, there are different things that they've done through their provincial association. So we're working towards permitting these activities to begin late next week. We've set a deadline of July the 3rd for that. So we're hoping to get people onto those sports fields. And so you're quite right. It could be, baseball, could be soccer. I'm not sure about all the regulations around football because I haven't seen the guidelines from the provincial organizations. But to your point, it's not limited only to soccer on our fields. We do permit for a variety of sports, and provided that they can get approvals through their provincial sport organization, we will allow them to permit. So the way it works is they can request the permit. They need to demonstrate to us that they've met the guidelines from their provincial associations. And so just the soccer one was the one where they've left one portion of those guidelines to the municipality to determine. And so we worked a little bit within our team here at the city to come up with what we thought was a safe level.
Thanks, Paul. And for Deputy Mayor Jackson, you characterized Hamiltonians as having done a good job. Although 44 deaths is too many, but what is your characterization of Hamiltonians during phase 2, and what you've seen in terms of restaurants and patios and beaches and playgrounds and whatnot?
Dale, I want to tell you, driving around the last week or so since stage 2 was allowed in Hamilton by the province, there's an excitement, there's a cautious, I would say, Dale, a cautious excitement in the air. People just want to get out, continuously doing it safely, properly social distancing, but just wanting to get out to try to be with others, to support so many in our hospitality, restaurant industry, many in that industry. I've said for months, my heart is broken for those owners of those establishments who employ thousands of people across our city, in the pubs, the restaurants, the lounges, and just trying to survive during COVID time. I know every Saturday I went to a pizzeria place to at least try to support that pizzeria with a safe pickup and drop off, to at least allow many of our establishments to even just survive, pay the bills, not even drawing any income. So I have detected in the last week a cautious excitement, people wanting to engage and get out there more, try to support the local retail industry. And I'll stand by the feedback I've received. And that's not to let our guard down. That's not to rest on our laurels. But overall, what I've received is Hamiltonians are feeling pretty good about 4 months of literally being restricted, confined to their own homes and their immediate families, that now they have an opportunity to breathe, if you will, and slowly, surely, but guardedly, hopefully to return to some form of normalcy, Dale.
Thank you so much, Deputy Mayor Jackson. So our next question goes to Matt from the Hamilton Spectator. Matt, you can go ahead.
Hello, everybody. Can you hear me?
Yes, we can.
I guess this is a question to Paul. Paul, you mentioned the 70% plus mask usage on the buses. I have to admit, a lot of people have either reached out to us, or you can see them sort of commenting online about buses that don't seem to have a very high percentage of people wearing masks. And it seems to be a source of worry for some people. So how much sort of data are we working with? Are there some routes that are better than others, or what are you seeing?
Yeah, I'm sure there are. And so we're looking at it. This is early days. We're trying to gather as much information as we can. And we're actually going to, continue to drill down even a little bit further with our operators and whatever data we can gather in terms of looking at it. And so I'm sure there is a variation, but recognizing that, across the system, this is what our leadership is telling us. So in certain areas, perhaps it's a little bit lower, and in other areas, a little bit higher. But I think the point is, it is a good start. Let's try and keep this going. We need to get there in terms of that, that goal of at least 90%. It'd be nice to see some buses with 100% usage, because I just don't believe every single bus every single time would have people that couldn't wear masks. But maybe that's true. But it's certainly getting it to that 90 or 90 plus level would be great. And I think that we just are going to continue to encourage it. There is really no effective way to enforce this. We are not going to ask people personal health questions in terms of denying them a ride, and nor are we going to spend the resources to bring on a large number of people to enforce this. That would be a huge team that would be necessary to do that. So we're going to have to do this piece of work well and continue to encourage that as these days and weeks go by, and as the increased use of our transit system occurs as well. And that's really why we're doing this, is that we know with increased transit use and increased numbers of people on our buses, which is what we have to have in order to have a sustainable transit system, that the ability to maintain that 2 meters, full 2 meters of physical distancing is just not going to be possible. So the message needs to get out there, and I think the more people can provide us with information about where they're not seeing good compliance, that will help us to encourage that compliance and get out there. So I know our transit user community is very strong. Continue to help us do the work that we need to do appropriately, asking people to use masks, but even giving us the feedback of a route where they may say, geez, there were 20 people on this bus and 2 with masks. I mean, that's helpful information for us to know, because we can follow up and see if that's a trend on that route or not. And if there's places that we need to go to help encourage the mask use, that would be great. And I do know that next week we're going to provide some information about how we're going to provide some free masks to the community for those who need it, who may not be able to afford it or find them. We do know that there's been some questions and some concern about that, and we're going to have some announcements next week about that as well.
Okay, Paul, it looks like you preempted my next question, but I'm going to ask it anyway, just to see what else you'll say. So the bus drivers had indicated that they would like to hand out masks where possible. So you're saying that something of that nature is going to be announced? Is it going to be across the board, or is it going to be certain routes, or?
We're going to announce how there'll be availability of free masks. There is an awful lot of logistics to think through. And so one of the things that we've done, of course, is to put in the Bioshields so that there is a physical barrier between our operators and those that will be boarding through the front. So we have to work through that, and whether on the bus or off the bus or through organizations is the right way to do it. And we're working on that actively, and I've seen some of the draft information around that. We just need the weekend to sort it out. And we're going to announce it early next week, and particularly announce it prior to us launching into on July the 1st, getting back into the fare collection business. So stay tuned for some more of that. But it is challenging because, we can say it's one way, but then that breaks down some of the other health issues we're trying to accomplish in terms of keeping people physically separated or have a physical barrier there. And we also are not just going to have them available for people just to pick out and on their own. So we have to control the way it goes out. We have to find the right ways for it to go out. We want it to be proactive as well, and get it in the hands of some of those who really struggle perhaps with the ability to purchase or find them themselves. So lots of things at play, and we're going to announce next week a beginnings phase of how we're going to do that.
Thank you.
Great. Thank you so much for everyone for your questions. Mr. Deputy Mayor, that's the end of our media questions for today. So I'll pass things back to you for some closing remarks.
Thanks, Jasmine Graham. And listen, to the media representatives, thanks for being and participating in your questions. To Dan Takuma, Katrina Clark, Joanna Ferketich, Joey Coleman, Dale Manuknuk, and Matt Van Dodgen. Appreciate very much your continued messaging, helping the community through this dangerous time. Also want to thank those watching on YouTube, Cable 14, and or listening in on the phone-in lines. Thanks to Cable 14, our wonderful community cable station for many decades, specifically General Manager Bill Custers and McLean Media for their support in putting these events together, these virtual events through the pandemic, making sure things have run smoothly as well. It's been my honor to fill in for His Worship Fred Eisenberger today. Once again, as June is winding down, salute a senior, especially a volunteer senior who puts out every day to help others and make their lives a little better. And all of us, once again, as our Mayor Eisenberger is self-isolating, we wish him the very best. Hope to welcome him back very soon. Have a safe weekend, everyone. And remember, happy 153rd birthday, Canada, on Wednesday. Thank you, everyone. Thanks, Jasmine.